abroad and your various platforms. Welcome to our regular press briefing on our response to the COVID-19 virus. Today we'll use the same format, and I'll ask Dr. Parasram to lead his team in presenting us with the latest results of our performance.
Hi, good afternoon. Thank you, Honourable Prime Minister, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. So we begin as usual with the COVID-19 report for the 25th of June 2021. The tests done so far now at public and private facilities, 224,850. Over the last 24 hours, we would have reported 346 new cases, taking our total since 12th of March 2020 to 31,775. Thankfully, 23,371 of those have recovered to date, and our total active caseload has gone down to 7,613. Those in home isolation stand at 6,736. In state quarantine, 331, and 146 persons in step-down facilities. Deaths now stand at 791. As of yesterday at 4 p.m., total persons vaccinated with the first dose, 194,212, and those with second dose, 63,647. Dr. Hines, as usual, will now present the Epi Summary, followed by Dr. Richards. Dr. Hines?
Thank you, CMO. Honourable Prime Minister, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. The epidemiological update for the data as at June 25th is as follows. Looking at the epidemic curve, we see that we have continued to see a downward trend throughout the month of June. It is not a rapid downward trend, it's a slow decrease, but we are seeing a consistent, though slow, decrease in the numbers of cases showing up as positive as appearing by date of swab. So we're seeing that downward trend. The blue bars, which are the bars representing June, getting progressively shorter, meaning fewer cases, moving from left to right. Looking at this same data, but pulling it together on a weekly basis, what we've seen is that the gold bars, which are the bars for May, were the tallest, and then we started to see some progressive decreases in the heights of the blue bars, which are the weekly cases during the month of June. Now, we looked at the percentage decrease that we saw in that time period. We saw that between the week that started on the 30th of May and ended on the 5th of June, and the preceding week, there had been a 10% drop. So the week beginning on the 23rd of May and ending on the 29th of June, had 3,557 cases. The following week had 3,191. That was a 10% drop. The following week, there was a 30% drop. And then the week after that, that was the week beginning on the 13th and ending on the 19th, the drop wasn't quite as steep. It was only a 6% decrease. We also looked at the background, the salmon color, that salmon color representing the percent positivity, meaning out of every 100 samples that were taken, what percentage turned up as positive. And whereas we were seeing a relatively steady decline week on week, we saw a plateau where last week and this week basically we have the same approximate percentage positivity. So it's something that we're looking at, we're looking out for. We know we're in a delicate equilibrium right now between movement and cases. So we're looking at these indicators to see what's happening with respect to our decrease. With the preliminary data coming in from the lab today, we should have approximately a 25% decrease comparing the total this week with the total the week before. So that's hopeful. It's again going in the right direction. Looking at the same data pulled together on a monthly basis, we see that we're now nearing the end of June, and we have not approached the total that we're seeing at the end of May, which again is a clearer demonstration of that slowing that we've seen from one month to the next. We also see where that salmon area gets a little lower, so we're now looking at about overall for the month of June, about 33% or so positivity, coming down from a high of over 43% during the month of May. The demographics, the distribution of age and sex for those who are diagnosed as positive remains largely the same. About 50-50 male and female, majority of cases in that 25 to 49 age group. And the fatalities have demonstrated and maintained a little bit of a swing away from the overwhelming male preponderance, where it was 75% men. It's gone down to about 60% men. We are seeing in that top right-hand pink bar representing women 85 and over that there was an extension, a little increase in that grouping, again, possibly due to the virus affecting a few of the elder care facilities, with consequently slightly higher rates of overall fatality. We also note that looking at our projection for the last, the 2 weeks just gone, and extending that to the end of June, start of July, we expect that our numbers, if we continue as we're going, would follow that gray line that projects off the end of the right side of the graph. And we're looking at that performance against the blue bars that we see moving from left to right and getting progressively taller and now beginning to slow. So those blue bars are actually falling a little below that gray line, indicating that the slowing that we are hoping to see continues, although it is actually very gradual. So we are seeing gradual slowing, a gradual reduction in the rate of infections. And again, the point from this is we need to maintain a large degree of the adherence to the public health measures in order to continue to get this trend to move in a downward direction. With that, I turn you over to Dr. Richards.
Good afternoon to the Honourable Prime Minister, the Honourable Ministers of Health, Energy, National Security, and the Office of the Prime Minister. Good afternoon to my colleagues led by the Chief Medical Officer, members of the media, the viewing and listening population of Trinidad and Tobago. Thank you very much for joining us at our press conference this afternoon. This afternoon, I'd like to present a summary on the status of the hospitals in the parallel healthcare system. And as you're aware now, we have 16 facilities in the parallel healthcare system to care for confirmed COVID-positive patients with a total bed capacity of approximately 1,022. And this is across 3 levels of care: ward level, high dependency unit care, and intensive unit care. This graph demonstrates the rolling average, which is the average number of cases over the last 7 days per day, and it's currently at approximately 227. And I always start with this graph because it gives us an indication of the future need for hospital beds. So if that number, the rolling average, is larger or higher number, we anticipate that within 5 to 7 days we would require additional hospital beds. A positive sign here is that the rolling average generally has continued to decrease by and large. We're also looking now at a graph that looks at the daily new cases, admissions, and discharges. Of course, if we have more new cases, we expect to have more admissions, and admissions, of course, would have to be discharged at some point. And this graph itself really looks at the ability of the system to continue managing patients. I'd like to point out that over the last week, the gap between the admissions and discharges narrowed even more significantly than it has been over the last 3 weeks. And actually, this has been the narrowest gap between admissions and discharges since the 1st of May or so. And that, again, is a positive indicator. I'll now explain why we have seen that gap narrow, meaning there were less extra patients presenting over the last week than previous weeks. So we look at net admissions, which really would be the total number of new patients in the facilities or the hospitals, and we subtract those who are allowed home or those who are discharged. What we noted in the last week, and it's the first time that this has happened since Monday, is that there has been a decrease in the total number of persons being admitted to the hospitals. So our hospital numbers have started to decline. We were looking at a sort of increase or plateauing phase for the last 3 weeks, but now we are actually seeing a decline. And we also saw a significant number of discharges in terms of patients being allowed home. As you can see, over the last 3 weeks, the number or additional number of patients that have entered the parallel healthcare system for care was increased by 112 in the last week, and that has been less than the 2 previous weeks. So there has been a downward trend or a decline in the number of persons accessing or additional persons accessing the parallel healthcare system for confirmed COVID-19. Now, this is another graph that we look at, and this looks at actual numbers versus occupancies. And it gives us an indication as to the number of persons who are receiving care within the parallel healthcare system. Again, over the last week, we have now noticed a decrease in the number of persons that are in the parallel healthcare system. Today, we have 528 persons across the 16 facilities in the parallel healthcare system, of which 386 are at the 9 hospitals for the more ill or the critically ill patients. And that's a number you would see identified on the media release on the first page that CMO would have shared. And the remaining 142 persons are in step-down facilities. What I'd like to reiterate to the population is that although we are seeing a declining number in persons seeking care, unfortunately, we continue to see a balance of there being more critically ill patients, that is those in the hospitals, versus those in step-down facilities. We also look at occupancy, which is the total number of patients or persons in the hospitals divided by the total number of beds. And this gives us an idea of how we can manage future cases or further cases. Again, overall, across the 16 facilities, we continue to see a decrease this week again, and our current occupancy is at 51% and decreasing downwards. The last time we would have seen that sort of metric or that sort of level would have been on or around the 1st of May. So we are seeing occupancies decreasing. We then looked at Trinidad and Tobago versus Trinidad and Tobago's occupancy versus Tobago. And in Trinidad, we are seeing a decrease in the overall occupancy. That is currently at 54%. So on average, half of the beds in the parallel healthcare system in Trinidad and Tobago, are filled versus Tobago, where it's at 20% at this point in time. Now, there are 9 hospitals in the parallel healthcare system that manage critically ill patients. And these are the hospitals that we tend to keep our eyes on in terms of concerns about persons receiving adequate care and so on. These are the hospitals that have the most doctors, nurses, ventilators, requirements for medication and oxygen. And we would note that between weeks 19 to week 25, the number of beds or the number of hospitals increased, because we were adding hospitals to the parallel healthcare system to keep up with the demand for beds. Now, in week 25, which is where we are at, which started on Sunday, you would note that now only 2 out of the 7 hospitals in Trinidad and Tobago are above that critical factor of 75%. We use 75% occupancy as a sort of critical level for identifying when things are becoming, or when we have challenges in the system in terms of allocating doctors, nurses, oxygen lines, hospital beds, and so on. And for the first time again this week, we have seen less hospitals reaching that threshold. At present, it's only the Arima General Hospital and the Augustus Long Hospital, both at 85% for this past week. It's interesting to know that the Couva Medical and Multi-Training Facility, which treats our most ill patients, has been showing a decreasing number of patients, and today is in the vicinity of about 52%. When we look at the ward occupancies in terms of the level of care, we have 3 levels of care in the parallel healthcare system. The majority of patients require what is called ward-level care. They are critically ill, they require oxygen, possibly by tanks, but they can walk around and they can take care of themselves to an extent. And you would notice that the ward occupancy levels continue to decrease. This graph demonstrates that. And today, ward occupancy is at 47%, which represents a significant decrease from last week. Now, in the box at the top, you would note that today's ICU occupancy is 70%, intensive care unit occupancy, that is, and your high dependency unit occupancy is at 86%. This demonstrates that even though we have falling or decreasing hospital numbers, our patients and persons with COVID continue to be very ill. although today 70% of the ICU beds that are available are filled, the average over the last week has been 83%, and the high dependency unit beds have generally been filled between 90 and 100%. This is very important for us to note and to not be prematurely comforted by the fall in numbers, because it demonstrates that persons with COVID-19 are seriously ill and require long stays at hospital in these units. Okay, so one of the emphasis on the parallel healthcare system was to protect the traditional healthcare system, and we have been seeing a positive indicator in that the number of COVID-positive patients in the A&Es continues to decrease at our traditional or our non-COVID hospitals. Those are patients who would present by ambulance and then be transferred into the parallel healthcare system, and that has shown a progressive decrease. The ambulance transport system also has shown a general decrease over the last week with respect to COVID-19 transports. This morning we were at 30% of all transports over the last 24 hours versus what we were seeing it earlier on, between 40 and 50%. So it shows that less ambulance resources are being required for COVID-19 patients. And lastly, the time taken for the ambulance has actually decreased. So we are seeing a shorter turnaround time for persons who require, COVID patients who require care with ambulances from our ambulance service, and that has declined from 150 to about 120 minutes. Ladies and gentlemen, this afternoon I bring with you a message on behalf of my fellow frontline workers across all ministries, not just health, but also national security and others. And I would like to remind everyone that although we are seeing a decrease in the number of hospital figures, we should not become prematurely comforted by these numbers. We still have a significant number of very ill patients. And while we thank the population for continuing to follow the 3 Ws, as Dr. Trotman will explain, we need to continue to persevere to ensure the resilience of the parallel healthcare system. We hope and we believe that if we continue practicing the measures that we have requested and humbly asked the members of the population to adhere to, wash your hands, wear your mask, and watch your distance, we will continue to see a decrease in the number of cases for COVID-19 and return to some sense of normalcy soon. Thank you very much, and I now pass you on to Dr. Trotman.
Honorable Prime Minister, ministers, fellow colleagues, members of the media, members of the listening and viewing public, members of the healthcare profession and ancillary services of the healthcare community, I want to recognize the fact that amidst all of the COVID-19 experience, we are able to procure vaccines to assist with the fight. I want to also take the opportunity to remind others and everyone that inasmuch as it protects us from getting it, the clinical experience, unfortunately, that we are having is that, and which is what follows the science, is that even as you get your vaccine, one vaccine is not enough. And unfortunately, we do have deaths. We have sick people who have had one vaccine. So it underscores the point that even as we want, when you are called, when the vaccine is available, and you are called that you go for your vaccine, that you remember that you must continue to practice your 3 Ws to protect yourself. Full vaccination is, as we've said before, in our instance, 2 shots of your vaccine at the recommended time, 2 weeks after that. In the meantime, continue to practice washing your hands properly, wearing your mask properly, and watching your distance. We thank you for all of your patience. We thank you for all of your cooperation. We thank the healthcare workers for all of their hard work. Thank you.
Thank you, Dr. Trotman, Dr. Richards, Dr. Hines, and Dr. Parasram for your introductory data and exhortations. I now call on the Minister of Health to advise us as to how the vaccination program has been progressing.
Thank you very much, Honorable Prime Minister, my cabinet colleagues, Minister Young, Minister Hines, Chief Medical Officer and his medical team, ladies and gentlemen of the media, and to all citizens and others looking and viewing on the various platforms. Before I just give you the vaccination drive update, as Minister of Health, I would like to join with Dr. Trotman in once again, and we can't say it enough, thanking all healthcare workers and frontline workers, whether you are police, army, sanitation, every single frontline worker. Thank you, thank you, thank you. So the vaccine update to date, total first dose administered, 197,705, broken down across 5 RHAs, 4 in Trinidad, 1 in Tobago, and state agencies, these are ministries that we are vaccinating, and other agencies, these will be the private sector entities like manufacturing, construction, and so on. So a quick breakdown: Northwest RHA, 30,144, North Central, 44,552, ERHA, 27,234, Southwest, 39,286, Tobago RHA, 9,260, state agencies, 9,925, and the other agencies, 37,284. So that's our first dose. Second dose, which will help us, as Dr. Trotman said, when you get your second dose, that is when you are considered fully vaccinated 2 weeks after receipt of your second dose. We are currently at 68,944. So the 5 RHAs have already started their second dose regime, as you can see. The state agencies, that is the ministries, have started. The other agencies will begin shortly. Next slide, please. Right. So this is a really important slide. The goal, based on the number of vaccines we have currently, this is not the end game. This is not the final target. The final target is much higher. The goal 1 at this point in time, the horizontal purple line, is to have 188,900 persons fully vaccinated by July 31st, 2021. The green line shows the total number of people vaccinated with their first dose, 197,705. Why is that amount higher? Because we are continuing with first dose. We are not stopping. We are continuing, but it may continue at a slower pace because of vaccine availability, and then we have to ring-fence doses for your second dose. The more interesting line is what I call the aquamarine line or the blue line, whichever color you choose. Last week, Saturday, we had said you want to see that line get as vertical as possible, which means you are accelerating your second dose. So said, so done. It is getting more and more vertical, which is what you want to see. So total people fully vaccinated with their second dose, well, I shouldn't say fully vaccinated. Total people with their second dose, 68,944. They will be considered fully vaccinated 2 weeks after receiving their second dose. So, by and large, we are on target to achieve our first goal, which is predicated on the number of vaccines we have now, of 188,900 persons with their 2 shots by July 31st, 2021. The key message, as Dr. Trotman has said, and which we would like to reiterate, when you are called for your second dose, please avail yourself of the opportunity to take the second dose. Okay? So that is where we are now. The progress is good, and I want to thank again all healthcare workers and urge everyone, when a vaccine is presented to you, to take it at that particular time. Thank you very much, Honorable Prime Minister.
Thank you very much, Minister Dayal Singh. And I think this is a good point for me to join the conversation with respect to vaccine procurement. We are now, for all practical purposes, at the end of June, and we are looking towards the period of July, August. And much of what we can say today was said already as to what is likely to happen in July into August. With respect to vaccine procurement, the Minister mentioned that we are still doing some first doses because we have a small amount of vaccines available that can do the first dose. And remember, once you do the first dose, you have to be able to hold vaccines in hand for the second dose, wherever that second dose is coming from, whether you have it in hand or whether it's on its way to you. And also that every person in Trinidad and Tobago so far who has got a first dose, there is a second dose available and waiting for you. And because of the scientific use of the vaccine, we can't just give everybody the vaccine on the same day. Your second dose becomes due at a period of time after you had your first dose. So those persons who had their first dose earlier, they are now in line to get their second dose earlier. And those who got their first dose recently have to wait for a period of time before the second dose can be applied. And that is why we have pretty much seen it stretched out down into July. I can tell you, as I did mention before, that we are close to confirmation of shipping of another dose of Sinopharm vaccines from China, which should be here in the early part of July and approximating upwards of 200,000 doses. We also have confirmation of a shipment of COVAX from the COVAX, which would be our last COVAX committed shipment to take us to the 100,000 doses that we had been allocated in the beginning. Initially, we all thought we'd get 100,000 doses up front, but because of the vaccine unavailability and the inequity that has been going on, we've been getting it in tranches of 33,600. We got 2 of those already, and the last one is to come in, and that is due in, we have an approximate time in mid-July. So during the month of July, even as we are applying our second doses to all those persons who got their first doses, we will also expect to receive 2 sources of vaccines to continue the first dose program. It's quite possible that for a week or so, we may not have vaccines for our first dose. But certainly by the second week of July, all things being equal, all transportation activities and logistics working to suit, we should have vaccines in hand to continue the first dose. And we will have, from the work that is going on now, we will be able to do in July a major vaccination program of the first dose, while holding significant volumes for the second dose. So July should see speeding up of the numbers of persons actually vaccinated. So it's important for persons who have not been vaccinated to date to listen to what the Minister has said, to listen to the entreaties of what Dr. Trotman has said, that once you have not been vaccinated so far with any dose, first or second, particularly your first dose, once the vaccines become available in the month of July, give the first week a pass. But anytime after the first week, we expect to be calling on you to make yourself available to be vaccinated in a program where we should have enough vaccines to keep us busy for July. So those 2 streams are now, we are now awaiting shipment documents. But the confirmation of the shipments during that mid-July, early July 1 portion, mid-July 2nd portion. And of course that takes us to August. And you remember I told you earlier on that the vaccines we are expecting in August are the ones that we have made that down payment on with respect to the African Vaccine Acquisition Trust on the African Medical Supply Platform, and we are expecting towards the end of July to begin to receive vaccines from that tranche. I can also tell you that we have been in very positive contact, discussions, work with the United States with respect to the commitment to supply vaccines to Latin America and the Caribbean. We are at the stage now where we are confident that the Caribbean has been separated from the others, and we have had some documentation in place, and we expect that in the very near future that those discussions will be concluded and the logistics of movement will start. So that's another. Since I spoke to you last, when I spoke to you last, I spoke about the U.S. vaccines as our tranche 4, tier 4, but a lot of progress has been made in the last week to 10 days between where CARICOM through CAFA and the United States authorities. We've made significant progress there. And at CARICOM, our attorneys general of the regions have intervened as required and have made the commitments that are required for those movements. So with a little patience, I expect that in the next not too distant future, days or so, we'll get the news as to exactly what those numbers are. But suffice it to say at this time that we have made considerable progress there, and our anticipation is quite high. So with respect to vaccine availability, in the month of July, going into August, we should have the program of vaccination moving considerably forward. We have one other minor inflow. Our friends in St. Vincent have 4,000 vaccines which are to expire in a matter of days. As you would have been told about this before, they have offered it to us. We can take those vaccines, and we have made every effort to. And today, we are in the process of making the physical effort to get those vaccines into our hands. And even though they're going to expire in a few days, we have the infrastructure in Trinidad to be able to use them before they expire. And we will use them to conclude the vaccination of persons who have already been vaccinated. So that would be 4,000 second doses that we can do to save those vaccines from being expired and wasted. So this only happens because of the close cooperation that we have between our CARICOM neighbors as to exactly who's doing what and with what, and if that kind of threat arises, we can intervene in this way to ensure that we do not pass up opportunities and that not a dose is wasted. So that is where we are with the vaccination program. It is a lot brighter now with respect to the vaccines coming into the country, and the program of vaccination should therefore be a lot brighter. What I want you all to look at is the fact, the worldwide fact, that we are learning, adjusting, and treating with this virus on a daily basis. There's no conclusion as to what is going to happen once you have done certain things. We started off with one variety of virus, and over time, that variety has been changing and causing new problems requiring new governmental resistance. So as we make plans, those plans are being affected by what is happening with the virus, not only in our own country. In fact, it is most important, the decisions we make in Trinidad and Tobago. We make those decisions on a fairly good understanding of what is happening elsewhere, because we are not doing anything here which other people are not required to do elsewhere. And having said that, I would like the people of Trinidad and Tobago, those of you who have the ability so to do, or the time, or the intention to be properly informed, I want you to look at what is happening in the following countries and following continents. Look at what is happening in India. Look at what is happening in New Zealand. Look at what is happening in Israel, Australia, the United States, the United Kingdom, and St. Kitts and Nevis. This group of countries from Australasia to the Caribbean represent the range of the threat of COVID-19. India, you may recall, in the early part of this year, was in a comfortable position of being the supplier of vaccines to the world, having the tremendous infrastructure to produce the vaccines that were deemed to be effective, and so on and so on. You look and you see what's going on there now, where the situation has changed completely because the virus has exploded in India, and of course the numbers of deaths and sick people, and of course the effect on the economy has been tremendous. Australia, a continent which is a nation by itself, a whole continent, one nation, you would see today that the largest city in Australia, Sydney, is cut off from the rest of the country, and other states are refusing to accept or have made rules that you can't travel from Sydney to other states. And each state is laying down its own regulation as to who comes in, who goes out. Because in New South Wales, there's a huge outbreak and a dangerous variant. You would have seen before, we were talking about the P1 variant from Brazil, the Indian variant, which is now called the Delta variant. And I would like to ask Dr. Parson, after I've made a few comments here, to speak to us a little bit about this Delta variant, which is what they're all looking at now. It is new, came from out of India into the rest of the world. It's very prevalent in Britain now. I think it's 85% of the United Kingdom population reporting confirmations are now that variant. And the UK is a country, like the United States, which has had access to an unlimited supply of vaccines. And they also do have a significant portion of their population already vaccinated. But they too now have challenges. In the United States, it's an anticipation. In the United Kingdom, it's already on board. And of course, Israel was probably the first country that had vaccinated so many people that they were regarded as having reached the level of herd immunity. And of course, it was thought then that when you get to that point, everything was all right and you could just proceed. And because you have been vaccinated. Surprisingly, the virus says no. And you're having outbreaks in Israel, and they're now concerned. And the scientists are now saying it could be, after all the effort we're making now and all the money we're spending on one brand of vaccine or one phase of vaccination, getting to herd immunity, variants may arise, like the Delta variant, which may require human beings to have additional vaccinations as boosters to be able to cope with the effect of the virility of the new variant. So all these are possibilities. And of course, right here at home, you would have heard the Prime Minister of St. Kitts Nevis yesterday putting St. Kitts Nevis right here in the Caribbean from a status of one of the healthiest and COVID-free of our territories to one that is now almost, in fact, they are a little more locked down than Trinidad and Tobago right now because they're required to respond to the presence of the virus in the community, and they are now in lockdown, curfew, and no visiting between families, no intra-family contact. And of course, Africa, and bear Africa in mind, Africa is a huge continent with hundreds of millions of people, and that is where one of our lines of vaccines is likely to come from, the African Medical Supply Platform. But they are now experiencing, in many African countries, huge infection levels requiring massive doses of vaccines. And I did tell you last week, and it remains that way, President Ramaphosa did tell me that he is the head of the Authority Vaccine Acquisition Trust. He gave me the commitment that whatever is happening with them, that CARICOM will get some of the vaccines that they have. That what that some means, we don't know yet, because they have their hands full of their own virus problems right now. But because they are a large buyer, they are likely to get a large dose. But the most important thing is that the fact remains that lower middle income and low income and poorer countries of the world are still in receipt of less than 1% of the vaccines that have been produced. And of course, notwithstanding the G7 commitments last week that made commitments to a few 100 million doses, that is far and away below what is required to change this around. So we are all at different levels in the world having to face the same situation at different times, because you would have seen New Zealand having to do some restrictions this past week, which is quite surprising because they were so relatively clean and distant from the mainstream of things. Today is when I had promised to tell you about two developments that we had said we would do if the situation remains as we had projected them to remain. I could conclude by saying that we have not done too badly. We have not reversed our position, but we have not accelerated to the point of comfort that we would like to have been. We are at a point now where Dr. Richards, who gives us the most important data, which is our ability to respond, to provide health care to those who require it, we have come down into a reasonably good place with respect to hospital service availability. Dr. Hines told us that the graph has come down a bit, but where we at on all these parameters is that we could take the decision now that is good enough to exhale a bit. But if we do that, the gamble is that we could reverse. It is very reversible to have us go back to a situation where we may be forced to take harder action than we are taking now. So the government has to take a decision. Do we make decisions now based on how good it has been, with a great chance of reversing the progress? Or do we very carefully hold on a little bit longer to be in a stronger position so that we do not reverse to a situation where we'll be forced to do certain things? The government has considered this very carefully, and we have decided, given what is happening, that there are certain things that we would do, and there are some things we would not do to preserve our pathway to a better position. We did say that we will attempt to open construction on Monday. After full discussions with all the experts and looking at the numbers and the possibilities, the government has decided that we will take the chance of holding on to the direction and having it go a bit further onto positive ground, rather than do what has been done before by some people. And we don't want to do that to prove it. We know if we do it, it's likely to happen, which is to open up too early, get ourselves forced back into situations that we had passed. So we will not open construction on Monday, the 1st, but we will open government construction on the following Monday. Monday, the 5th of July, all government construction will reopen. We will hold the private sector construction for view after the next week and see what report we get from Dr. Hines and Dr. Richards, and hopefully we should be in a position then to be able to expand. We have vaccinated how many construction workers so far?
We would have done 15,000.
Okay, 15,000 vaccinated construction workers, but they have not all got their second dose. But what I've just said will allow us to second dose some of them. Yes. And by the time we open private sector construction, we would be having a heavily vaccinated population of approximately 40,000 people. Is that the number? Yes. Yes, in that. And that will put us in a much stronger and safer position with respect to a major sector of the economy. That stronger, safer position would be the pillar on which the other sectors of the economy would roll out, rather than gamble for an early start on Monday and run the risk of a large number of unvaccinated people reversing what we have done. So it's a little disappointing to tell you that, but take comfort in the fact that you have a commitment that on the 5th of July, those of you who are working on government projects, and you know who you are, you will be at work, and most of you should be vaccinated, and that the country should have in hand, in a matter of days after that, enough vaccines to run that program straight through to the end of the month. And the major disappointment is with private sector construction at this time. And of course, we spoke about the airport, or ports of entry. We stay with that under the following guidelines. And as per we expect to recognize two categories of people, in fact, three categories of people. Category 1 are citizens of Trinidad and Tobago vaccinated. Category 2, citizens of Trinidad and Tobago unvaccinated. And category 3, other persons unvaccinated. The exact date in July, we expect, is Monday 17th. The Saturday 17th of July, that's when we expect to go back to scheduled services, open our borders to those categories of people. Non-nationals of Trinidad and Tobago who are unvaccinated, and let me repeat that, non-nationals of Trinidad and Tobago who are not vaccinated against COVID-19 will not at this time be allowed to enter Trinidad and Tobago. Nationals of Trinidad and Tobago who are vaccinated, fully vaccinated, and a fully vaccinated individual is defined as a person who has received the required number of doses of a WHO-approved vaccine and have been 2 weeks since the final dose was applied. Such a person who is a citizen or resident in Trinidad and Tobago, legal resident I mean, would be allowed to enter having shown proof of a negative PCR test less than 72 hours or less old, and such a person would be allowed to travel into Trinidad and Tobago without hindrance and would be allowed to go home. I repeat that. Vaccinated citizen of Trinidad and Tobago with a negative PCR 72 hours or less would be allowed to come in and go home as a person who is fully vaccinated. A citizen of Trinidad and Tobago who is not vaccinated and wishes to enter would enter and must go into state-supervised quarantine for 14 days, and you must, in order to enter unvaccinated, you must be able to show proof of a PCR test no older than 72 hours. And the state-supervised quarantine would be at venues, certain approved hotels authorized by the County Medical Office CMO, and that would be at your own expense. Children who are not vaccinated at this time worldwide, we don't have vaccines that are applied to children, arriving with parents will be allowed to go home with their parents if the parents are vaccinated. So parents bringing their unvaccinated children will be allowed to take them home. And you will get a bit more information from Caribbean Airlines and from the relevant ministry about, we are aiming to use a digitalized system where persons wishing to travel could provide this information, their personal information, as requested with an app that will be available. And that information will be like your address, your health status, and so on, as you book your flight with the airline that you're using. This system is already in place at a couple of our Caribbean territories. We'll be using the same system here, and therefore it should run relatively smoothly. That is being put in place now to be able in 2 weeks' time to operationalize it here. So what I've given you here is a heads up as to who can enter, under what conditions you will enter. And of course, if you come in unvaccinated with your negative PCR test and you are allowed to come past the immigration officer as you should be, then you would be taken to a place of quarantine by the authorities under the authority of the county medical officer of health there. So this is a major development at a time when we also are keeping our eyes on this whole question of the Delta virus, which is beginning to appear in the United States, has not been identified in our country just yet, is very popular, 85% in the UK, appears to be very popular in Africa, and we still have the P1 virus out of South America into the Caribbean from there. So with all of this, it still means that we have to follow the basic protocols of mask wearing, distancing, and excessive hygiene of washing and washing and washing and keeping your hands clean. Those things will still remain in place. There is no exit into a safe place and a perfect place. COVID-19 and its variants are still very active and aggressive worldwide. Notwithstanding what you might be hearing from some people here in Trinidad and Tobago who have no responsibility for nothing. What you hear from the government are all the facts, all the data available to the people of Trinidad and Tobago as a wider worldwide response to the novel coronavirus. We will still be under the requirements to be cognizant of this virus. Vaccination does not mean that you've escaped or that you are fully safe. It means that you are strengthened, you are better able to deal with an infection. So we still have to work to avoid the infection. And most importantly, as long as the vaccines are available, we are required to use them to put each individual in that situation. So I would like to ask Dr. Parasram at this stage to say a bit about the Delta variant so that the population can have an idea of what is out there and what we are still nervous about.
Thank you, Honorable Prime Minister. So just to remind everyone, so there are 4 variants of concern right now. So there's Alpha, Beta, Gamma, and Delta. As you would have known them before, they have been renamed. Alpha is the B117, which is a UK variant. There's Beta, which is the South African variant. There's Gamma, which is known as P1, which is a Brazilian variant, and Delta, which is the Indian variant. So in terms of the what a variant of concern basically has 2 main issues that can occur with it, as apart from the initial lineage, which is the transmissibility, meaning the weights to spread from one person to the next, and of course the severity of it. For Delta variant in particular, there are studies in Japan that would suggest that it's 1.23% more transmissible than the Alpha variant, which is basically more transmissible than the original lineage. So when you put it in terms of R0, which is the number of persons a virus can spread to, the original Wuhan lineage would have been able to spread one person going to 2.3 people. The Alpha variant, possibly the P1 variant, going to 5 persons, the 1 person to 5 persons. The Delta variant can go anywhere between 1 person transmitting up to 8 persons from one individual. So it's much more transmissible. Studies out of Singapore say that it actually can cause more hospitalization, greater need for oxygen, and greater need for ICU care. So it's more transmissible, and it's thought to be more severe. Therefore, of course, is more deadly as you go forward. So it's a very concerning trend. WHO, as of the 22nd of June, has put it in 85 countries around the world already. So it's spreading very quickly across the globe. And as Prime Minister would have said, it's now the dominant strain in UK, quickly becoming the dominant strain in US as well. So, Prime Minister, that's a synopsis.
Thank you very much, Dr. Parasram. Now, we take note of that against the background of our ability and our involvement in a vaccination program. When we started out with COVID-19 in January of 2000, when no vaccine was available, our response was to come in, close the door, stay at home, to keep it out. We are not in that situation now. We are virtually having to live with, look at what's happening, and be sensibly responsive, and be concerned. And we are very concerned, which is why we are pleased that in the weeks ahead, we are expecting to vaccinate more and more people. But let me emphasize that the vaccination does not mean an end to the response to COVID. And I did mention a while ago, if you come in from outside vaccinated, as I described, that you can go home, what I mean is you will not have to go into quarantine. So you come in fully vaccinated as a citizen or resident of Trinidad and Tobago, you will not be required to quarantine if you come in fully vaccinated. If you're not vaccinated, then you have some issues. And I spoke with the authorities about the penalties for coming in unvaccinated and attempting to beat the system of not going into state-supervised quarantine. I'm going to talk to the Attorney General to ensure that those penalties are in fact a deterrent, and that the law enforcement will keep a close eye on that, because we know that there are people who are going to want to come in having not complied with the vaccination requirements, but between the immigration officer and the quarantine site may believe that they are already in Trinidad and Tobago, and also persons who may want to come out of that quarantine. One person caused Sydney to be shut down and New Zealand to be responding. It's one person. So any person who comes into this country and decide to play fast and loose with our quarantine system and our entry requirements will face the full brunt of the law. And we will make some adjustments to ensure that the penalty is quite a deterrent. So, at this stage, we'll take... let me just mention something else. One of the reasons why we have not opened up a bit more at this time in the economic side of things is because during the month of July, in fact, starting on the 1st of July, we are keeping our children and their exams in front of us. The government, notwithstanding other points of views, the government had agreed, the Minister of Health, Minister of Education has worked quite assiduously with this and with the parents and the wider community. And the SEA exam will take place on the 1st of July, which is next Thursday. That is a major development for us to get these children out of the psychological and mental stress of this exam being held over the head. I hope that by 3 o'clock on Thursday, it will be out of the way. I want to appeal to the teachers who are required to cooperate with the ministry. We've done all that is reasonable. It is not a perfect place anywhere in the world. And the call to do this is based on the technical, scientific, medical, clinical, and common sense advice available to the state. And it is not for others to arrogate unto themselves the authority to make this call. We simply ask you to cooperate, help the parents, help the children. You know all the pitfalls. We all know all the pitfalls. Let us try to avoid them and have the children come out, do their exam in this year of the pandemic, the second year, as a matter of fact, of the pandemic, and go back home as safely as possible. Once we do that, that would be an accomplishment, not only for the children, but for us as a nation. I have been told that 6,000 teachers have been vaccinated.
3,005 and another 500.
Well, 3,005 have already been vaccinated. First dose, and another 500 being vaccinated today. So that would make 4,000 teachers. We need 2,000 teachers to cooperate, to supervise, and act as invigilators to carry this exam out. Let us trust that on Thursday afternoon we can say that it has been done, and it has been well done. And then, as you know, early July, is the examination month. The CXC exam will be on the way. And thousands of students will take part in a number of exams on those days in early July. And that was one of the considerations why we did not allow more people from the economic sides to come out, to allow that 2-week period in early July, to have these students come out, those involved in parenting them, ushering them, transporting them, that those 2 weeks, we get them to do their exams, get back in, and certainly by mid-July, we can expect, if all goes well, to be more accommodating on the economic movement side. So these are our national issues, and this is how we've managed it, and this is how we're going to manage it. And if we cooperate, in 14 to 15 days or thereabouts, we should be in a better position. We should be able to announce to you that we've got certain vaccines and that the work is going ahead. As I speak to you now, the second dosing is going ahead. You would hear the minister would have said that it's going until the end of July, and you might ask, why not hurry it up? It cannot be hurried up beyond a certain point, because you need a certain distance between your first vaccine and your second shot. So that time is fixed by when you got the first shot. And those people who lastly got their first shot will get that second shot down towards the end of July. So the process continues in that way. So it is not only tardiness. I think the ministry and those people, its volunteers and its support staff who have been in the vaccination program, notwithstanding the hiccup we've had 2 weeks ago, all the reports I've had so far is that the population is satisfied that the work is going on in a very appreciative way. So I want to thank all those who are involved, and let's continue in that way to have it done. So let's have some questions now if you have any. It's quite all right to have none. Renuka? Yeah.
Mr. Prime Minister, Renuka Singh from the Trinidad Guardian. Your government allowed and approved the Department of National Security to receive a batch of Pfizer vaccines from a U.S. affiliate. Would that facility be extended to any private or other state organization that has a similar relationship to be able to access vaccines from an affiliate?
I have said before that vaccines coming into this country brought by the private sector, any private sector person or entity wanting to do that will fall under the law and the requirement to bring medication into this country. So anybody in the private sector who can get vaccine the same way the National Security Department had to justify to the Ministry of Health all the data as to where this came from, what authorization it has to enter this country, the same thing will apply to the private sector if they get their hands on vaccine. And if the vaccine passes muster in the way that those vaccines had, because even though they were coming to our government department, they didn't just come through because they were going to the government department. They were subjected to the extreme stringency of answering all the questions, because the one thing that we are not open to do is to have vaccines come into this country for which we are not satisfied of its origin, its efficacy, what's the content, because as a government we do know, we've had news and information of people receiving in vials so-called vaccines which turn out to be anything else but vaccines, salt water and otherwise, coming from sources that are, and I mean from day one I told you, given what the country and the world dealing with, charlatans will appear, and we have to protect ourselves from it. But even before this vaccination issue turned up, you bringing anything into this country as medicine, especially vaccines, because over the years, vaccines have come into this country in a particular way, and we are particularly careful about it. So I want to warn all those who want to bring vaccines into this country. Just remember, that is not something that you can come to custom with and say you want to help and you have vaccines. There's a very stringent examination process, and that is all in the hands of the Customs Department and the Health Department of Trinidad and Tobago.
My second question is the vaccines that we were supposed to be getting from Mexico, and the Minister of
From Mexico?
Yeah, the Minister of Foreign Affairs was dealing with it. But the Mexican Foreign Affairs Minister said they were supposed to come in last week. Do you have any update on when or how much?
No, we don't, because we are very grateful for the offer from Mexico, but all the vaccines that we are dealing with, they all are subjected to certain requirements, and as soon as those requirements are met and we have that information, we'll share it with you.
Prime Minister Johnson, November the Newsday, you said that we're starting construction on the government side. Most of these constructions are done by the Chinese.
No.
A lot of them.
You stop that one time. That's the kind of loose statement that is made. We have government construction on, let me just pick a few. We have the highway to Point 14, so that's probably the biggest government project, one of the biggest ones. We have Sangre Grande Hospital, which is being done. We have the Ministry of Health, that's a Chinese company. We have, there are a number of major projects. There's a mix, so it's not most of it being done by Chinese. There is some Chinese. Two of the major projects are the Central Block is the major one, and the Diego Martin overpass. But the others are largely local contractors. And of course, we have a lot of bridges and sort of those kind of construction. And the schools, we have a lot, school work and so on. All of those are, our local contractors are very, very involved in the government construction.
Looking at the Chinese one, in terms of vaccination, did the Chinese government supply their people with vaccination?
Minister of Health might be able to assist you with that.
Thank you very much. So when we got gifts of, so let's go back in time. When we got gifts of vaccines from SII out of India, the Indian High Commissioner did reach out to us at that stage and asked that Indian nationals in Trinidad be vaccinated from that gift. That was done. A similar request was made when we got the gift of 100,000. His Excellency, the Ambassador to China, made a similar request. And as we did it for the Indian gift, we did it for the Chinese gift.
Could you say break down how many?
No, I won't have that granular detail.
Anybody here would have that detail?
And I don't know that should really detain us, because we, as a country, have indicated to the international community that we take responsibility for vaccinating human beings within our border. As a matter of fact, the World Bank, there's one contact we had with the World Bank on one of their assistance programs. And to access assistance from the World Bank, one of the questions they put to Trinidad and Tobago, which I answered internationally from this building a few weeks ago, the question was whether, in fact, we will be vaccinating Venezuelan nationals who are within our border, who are here either in custody or who are here through our registration program or otherwise. And we answered yes, because if you answer no, that you will not vaccinate them, you then will not be able to access support from international agencies like that, because it is understood that we are not to discriminate against people with this virus. And it makes good sense, because the virus does not pick a person. All the virus wants is a human being. And if we vaccinate certain people and don't vaccinate the other people, the unvaccinated remain a threat to the vaccinated.
And let me just support the Prime Minister. The Ministry of Health, Minister of Health, took a note to Cabinet in June 2019. In that note, it was a policy of healthcare to be provided for migrants. And that policy says clearly that migrants are entitled to be vaccinated for anything, whether it's H1N1, polio, yellow fever, anything. So it is government policy to do just that.
Yeah.
Joseph Wharton, TTT News. I was wondering if there would be any restrictions to the countries where the variant is prevalent, if we would have any restrictions on persons coming into Trinidad.
Not at this stage, because maybe I should have indicated that in allowing the border opening to come about, we did have categorization of low-risk and high-risk countries. But then we found that virtually there were so few countries that could be categorized as low-risk, given what is happening around the world now, that we simply just spoke about vaccinated and unvaccinated. But we will, if we require to, as we've done in the beginning, at the very beginning of the COVID challenge, we started out by saying coming from China, no go for 14 days. Then we expanded it to coming from Europe, and we identified a number of European countries. And then later on, it was just closing the border against all comers. So if we do have that requirement, we will, but at the moment, we are just watching it for the moment.
Between you and the Minister could clarify, I know you said that people coming in would have to pay for their state quarantine if they are not vaccinated.
Unvaccinated nationals coming in will be required to go into quarantine at a state-supervised quarantine. And
are wondering if it is we are going to do away with this provision. Could you just clear that up for
do away what?
With the state quarantine provision.
Yes, we are. So the state will authorize certain, and there are mainly hotels where you'll be quarantined, and you pay for your quarantine there. And what was being used for quarantine before becomes part of Dr. Richards' and step-down facilities for persons in intra-country who require health care below the level of hospitals. So that's the system that we're using.
Prime Minister, how has, if at all, CAL's downsizing affected the opening of the borders?
It has not. CAL's capacity to operate has been determined by CAL. CAL has looked at the situation, and the airline has restructured itself in a particular way. You just remember that 80% of the staff is still there. I think that's a figure that I'm familiar with. So I know we focus on how empty the glass is, but how full it is also important. CAL will still have 80% of its staff, and it will also have a significant amount of its equipment. And they have made the decision as to how they will function with an open border.
So has there been any discussion or consideration to loosening the restrictions for outdoor exercises?
No, not yet. What we have done to be able to get some productivity and economic activity on the construction side, and to be able to allow the students to come out of the stress and to get that very important selection program done, we are sacrificing on that side. So please exercise indoors or in your yard so that the children can go to school and have their exams, and that the construction workers, outdoor construction, can go out and continue to be productive in an environment which is pandemic. So later on, we will shift to that. We are making, and the government is aware of it, and the decision-making program is governed by it. We are making significant sacrifices, but with a purpose. With a purpose. I hope when I speak to you again in 2 weeks' time, I could tell you we had our children out for their exams. I hope nothing happens between now and then for them to continue seeing the exam and not being able to have it. The worst thing that could happen to us in education now is for us not to have those end-of-year 5th form and 6th form students to have their exams. If they do that, our next horizon for them is in September, the opening of the school year. By that time, from what I've said to you in the last few weeks and today, our vaccination program should have gone a long way. So September should be quite a different month, and certainly very different to April and May and June.
On that question, any special consideration for athletes who would want to use the stadium?
Minister, answer, please.
Thank you very much. So we work very closely with my colleague, Minister Shamfa Kajo. Whenever she requires, through the associations, permission to train, she writes to me, and we authorize that within 1 or 2 hours based on her recommendation for national training. So that is ongoing.
Yes, I should advise that and listen to this, a normal curfew. Remember I told you last time that this weekend that we are finishing here would be the last weekend of the abnormal curfew. So come next weekend, the curfew starts at 9 o'clock and goes to the next morning, which is what you had been accustomed to before we had taken advantage of the June period. So July will go back to what it was in May. So the curfew kicks in at 9 o'clock, and we also saying during that period in the daytime, if you don't have an emergency or an essential, stay in. It doesn't mean that because you have a curfew in the night, the daytime is to free up. Just remember
that. In your deliberations, did the topic of providing meals for students who's coming out later next week came up?
Where?
For SEA and then for CA.
I am not aware that there's an issue there, but because the children, they have a break, and then they go back, a short break, and then they go back to do the exams. But that kind of logistic, I'll ask you to talk to the minister about that. But I don't know that there's an issue about providing meals. The exam starts in the morning after breakfast. It goes, and it ends at 1:30.
I can get a question into the medical team. Dr. Trotman had said that after the signs of persons have contracted the virus after the first vaccine shot. Is there any data, any figures you can give us to say how many people?
Thank you for your question. We have noted since starting our vaccine program, just about a handful of people who would have still protracted the COVID-19 disease. I must preface it by saying that we are not able always to validate, because we don't have the actual vaccine cards. When we ask for them, people are in quarantine and so on. But yes, we are seeing people who have had their first vaccine a few of them coming in and still showing signs requiring hospitalization, unfortunately.
But that should not be a big surprise. It's not to say that the vaccine program is a waste of time. With the first dose, I'm sure Dr. Parasam would have told us this before, with the first dose, your level of protection at best is about 60%, 60-odd%, something like for some of the vaccines. And it's only when you get your second dose you get to the peak protection. And also, it depends on when you got the vaccine. If the day after you got your vaccine, you got exposed to an infected person, you would not have built up enough resistance in that period of time, because after you get the vaccine, it requires a period of time for the body to build up that resistance. If during that time you're exposed, then you get infected, and then you will turn up at the clinical stage as a person who was vaccinated but is COVID positive. So these are all the nuances inside there, so it shouldn't really surprise us that there are instances where people have been vaccinated, had one dose, not fully vaccinated, and then during that time they got infected. So that's why we're asking you, if you had your first dose, don't take comfort in the fact that you have been vaccinated. There's a second dose to be had that makes you stronger in responding to an exposure. And even after the second dose, it takes a few days to be, that's what the science is saying to us. There's another story I was looking at from 2 countries where they are reporting that vaccinated people, by and large, the mortality from vaccinated people have been very, very low. And what they've been facing are instances of mortality largely from unvaccinated people. That is still, I think that is still to be validated by the WHO, but some countries are reporting that. So if you're unvaccinated, you will fall into the group of people from which most of the deaths are occurring.
Let me just support what the Prime Minister is saying. I think the takeaway message is, even if you get your first shot, the public health measures of masking, washing hands, social distances still apply. What happens in the research? People have a false sense of security that they have their first shot, not realizing, and maybe one of the doctors can come up here and say, how long after your first shot you develop antibodies, the second shot. So maybe you could, anyone, CMO, Dr. Trotman, because this is an important message, that even with your first shot, you are not fully protected, and the public health measures still apply.
So generally speaking, it will vary depending on the vaccines, but generally 2 to 3 weeks after your first shot, you have some level of protection. It varies again depending on the type of vaccine. For example, with AstraZeneca, you tend to get a pretty high protection from the first one. But again, with certain other types, you get 50%, 60%. After your second shot, of course, we have been saying 14 days after your second shot, that's when you get your maximum efficacy, as is based on the trials, which is the phase 3 trials. And what vaccines are really built to do is prevent 2 things mainly: severe infections and deaths. So that efficacy figure that you see, 82%, in some cases 95%, is in terms of preventing persons from having severe disease and preventing persons from dying after they have that vaccine. Some have an added benefit as well of being able to prevent transmission. For example, AstraZeneca has the benefit of providing 67% protection from a fully vaccinated person being infected and transmitting that onward to somebody else. So there are added benefits as well, but you have to allow the time to take its course before you get that level of immunity.
Prime Minister, a non-COVID related question.
Finish with the COVID question?
Well, actually, can I just get one more in, Jensen? When we talked about this restart of state construction, the periphery businesses that supported, like the concrete blocks managed for aggregate, will those be allowed to open as well?
But those will get an exemption from the minister as manufacturing associated with construction. So all such businesses communicate for an exemption. Like I did say that last week, people like paints and doors and you mentioned blocks. Those businesses will get the exemption. And I would like to appeal to those individual businesses to encourage your employees to get vaccinated if the vaccines are available, as and when they become available. Because the more of those groups we get vaccinated, the more comfortable we will be with their interaction with the public as they are doing, as the business open. So, for example, a block factory, if people are coming and going, they're buying blocks or whatever it is, and the workers are vaccinated, it is better than if they're not vaccinated. And we hope that most of them by now would have been looking in that direction. Yes, your non-COVID question?
The term of the Commissioner of Police comes to an end in a couple of months. Are you willing to rate his performance? And as well, he has some vacation time saved up. Is the government considering buying out his vacation?
There's one. Why do we look for difficulty where none exists? The rating of the performance of the Commissioner of Police is not a matter for public consultation with the Prime Minister. That is a matter for the Independent Police Service Commission. There is a Police Service Commission whose job it is to rate the performance, and I as Prime Minister will not attempt to do that for you today. And then the second question you ask is his leave. Well, not only the Commissioner of Police, all public servants have leave issues. If at the time when his contract has come to an end, the principle of leave earned cannot be lost, will apply, not only to the Commissioner of Police. Any leave that any officer earns. So if his contract is renewed before, then the leave that is earned could be taken, or it could be carried on into the other contract period and so on. So these are all options. If he's not renewed, then, and he worked up until the period beyond when his leave should have been taken, then he's owed the leave. So these are all standard public service regulations covered under law and negotiations with the various agencies, the CPO, the union agreements, and so there's nothing there to really be disturbed about. Thank you very much for coming, and continue to do what we've been doing, and hopefully we'll continue improving to the state that where we want to be. Thank you.